Cardiovascular risk in young people with lupus, which is a chronic autoimmune rheumatic condition associated with inflammation, is underappreciated in clinical practice, and there are no clinical guidelines for this patient population. To address this unmet need, we, a group of researchers from UCL, partnered up with the APOL trial investigators. This trial tested atorvastatin versus placebo for atherosclerosis progression over 3 years in children with lupus. We aimed to investigate determinants of patient heterogeneity, as the APOL trial did not show benefit of treatment with statin. Therefore, we corroborated complex patient data, vascular scans measurements of carotid intima media thickness, which is a validated clinical outcome associated with cardiovascular disease in both adults and children, as well as serum samples to enable the discovery of biomarkers which can predict which patients need statin and are likely to respond to statins. We found for the first time that there is a significant heterogeneity of the thickness of the arteries of these young people with lupus, with 50% of them having increased atherosclerosis progression over 3 years, which was the duration of the study. When we tested cardiovascular risk scores for use in clinical practice in patients as young as age 14, we found that only 3% of these young people were stratified at high risk, despite 58% having significant atherosclerosis progression. When we investigated their complex lipid profile comprising 220 metabolites, we found a highly predictive signature of 6 lipid fractions, which are listed in panel 4, which are not routinely tested in clinical practice, and they predicted with 81% accuracy the patients who went into having rapid progression of their atherosclerosis. Surprisingly, these young people have normal lipid profiles based on routine test cutoffs, so they are not routinely identified at risk. This discovery addresses an unmet clinical need of accurate identification of young people with lupus at risk of atherosclerosis progression to enable tailored treatment interventions, and could have implications for clinical policies as well as patient selection for inclusion in clinical trials.